Hi, everyone. Welcome back to What Happens in Vegas. I'm your host, Dr. Stephanie Canestraro, and today we have our special guest back and co-host, Dr. Leah Barbaro.
Hi, everyone.
You should all know her by now. I wasn't holding my microphone. So today we're going to switch it up a little, and we're going to talk a little bit about honestly who we work with the most, which are professional athletes. But
Mhm.
a lot of what we talk about can also be applied to the general population because health in general is honestly very similar for all of us. We are human beings. So, yeah. So, some of the biggest things that we see with athletes are assumptions. Like
Yeah.
everyone assumes that they're getting the best care and or that they are healthy. And I think what people are starting to see in this day and age is that it's really hard to be healthy in general. And we're seeing it firsthand because from working with people pre-COVID to post, we're seeing a lot more issues that we weren't seeing before, namely lymphatics. That's why we're creating a course for it. But and we talk about lymphatics, like it's always good when there's two people who can tell you the same story.
Mm.
And we're seeing athletes that move around a lot, but
That
they still have really
yeah,
stuck lymph. Like
yeah.
they're moving more than anyone. So Leah treats even more than I do at this point. And so what are you seeing with players, like people
I
in
mean,
general,
people
but
in
players?
general, their lymph is way more stagnant. We've seen it in the last 5 years that there's just people's fascia is a lot tighter. Lymph is getting more stagnant. There's a lot more. Well, maybe there was always the disease, but there's a lot more disease that we're seeing acutely. And this does not negate the athlete population. We treat a lot of athletes. We see a lot of issues with their fascia. We see a lot of issues with injuries relating to their fascia and then also their lymphatic system. So, as Dr. Stephanie said, it's becoming pretty apparent, and that's why we decided that the best way to try to get our information out there was to help try to educate the general population, but also hopefully be able to teach some practitioners a little bit more about what we found and then how to be able to treat it. Because there is this idea that, and especially like she was already saying in this athletic population, that athletes get the best care and they have the best treatment, and they're always like prioritized number one. And I mean, working with athletes for me almost 10 years and you a lot longer, it's apparent that that's not the case. And time again, things are missed, and time and time again, injuries worsen because they're not addressed properly from the beginning. And what we're seeing now is it's really tying back into that lymphatic stagnation and I
Mhm.
mean, really even just nutrient deficiencies from like a core.
Yeah, so a lot of these players, they are just really good at their sport or, young guys from regular families that aren't necessarily fully educated on nutrition or, even advocating for themselves. They're taught they're in like a position of that they should be appreciative of
Hmm.
and,
Hmm.
someone can take your place at any moment. So, people even have to hide what's going on with them sometimes. And so that makes them vulnerable in certain ways. And then there's just the whole fact that they travel, they're on different time zones. And
Hmm.
you can apply this to pilots or even if you just travel a lot for work. There's a lot of, dirty electricity and detergents that are different on the sheets or pillows where you're staying. There's quality of food. There's not having a routine. There's the fact that like when everybody else is winding down, or under
Ramping up.
neon lights revving up
Hmm.
to entertain you. And then there's media on them and they are young kids. And then there's like keeping up with the other richer families and they're in this micro culture. So it's always interesting to just sit back and watch all of the patterns over the years. But I think that even that stress on the body makes them even more at risk for some type of autoimmune conditions and certain diseases that people don't talk about and that we're seeing. And they can start with lymphatic drainage issues and they can lead to, them getting a small hit and then they have post concussive
Hmm.
syndrome
And
or
it lingers.
and it lingers and then their blood-brain barrier is disrupted and people don't catch it or know how to seal up those linings or whatever it is. So we focused on the gut in athletes. I mean, I personally started working with athletes and working on their gut because I got really sick
Yeah.
after chiropractic college and no one was doing that now. And now it's becoming more common,
More, but still not that
but
much.
still not that much.
Like, even as far as a supplement perspective in the change rooms, it's still very basic. Whereas people think, oh, they have the top of the line of everything. And I mean, it's still leaps and like
Yeah.
bounds from where it should be.
Yeah, and I think now as like there it's just as because of necessity, wellness is starting to become more popular.
Mhm.
Like certain people are asking more questions
Mhm.
that wouldn't.
Yeah,
Like
that's fair.
because people that start reaching out to you, usually they don't feel great. And that's
Mhm.
why they're starting to be like interested in, oh, like what's this red light this guy has?
Yeah.
Like,
If one
how come
gets it,
that
then
guy's playing a
everyone
little bit better? And like, it's kind of human nature. But we kind of teach people just like we do with regular patients or, the general population, like how to detox in the off season, how to work their own fascia, like stretch fascial lines. Like we see a lot of people that are getting treatment on just the area that's injured, and it's almost shocking to us sometimes.
Yeah, that is honestly, I still think very shocking for me
Yeah,
because I feel like when we treat, we're always looking at the whole body. We're always, regardless of what the area of concern is, we're at least doing a scan. It doesn't mean we always necessarily have time to work on everything in one visit, but we're doing a scan to make sure if something else is potentially having a is a factor and is playing a role into the injury that we're addressing it. And if we don't have time that visit, then we're doing it the next visit.
mhm,
Like it's, so much is related. And so many times we've had people that are, or especially with hockey players, like, oh, their hips are tight. So we'll just focus on their hips. Oh, they just loosened my hip flexors or they just needled my glutes. And it's like, did they look at your ankles and your feet? What about your mid back and your rib cage is so rigid? How can you get any rotation with that? If your mid back is so rigid and tight, then you're going to be putting more pressure above and below. So now your low back might be a concern, or that's going to play into the fact that your hips are going to be even more tight. There's just so many other factors, and it is kind of shocking to see that those are not addressed.
yeah, it's crazy to me. Like this is a little PSA. Your lats, they do attach to your shoulder,
My
but
favorite
they
muscle.
start in your back fascia or low back. It's a like direct connection. And we see people with severe back and or hip problems where their lats have never been addressed. And that's crazy to me. And I feel like that should be like common knowledge. So if you're working on people and they're not getting better, maybe check their lats, check their feet.
Triceps,
Yeah, their triceps.
huge.
But again, something that we learned from me being sick, or like, I mean, it's not common knowledge. We clear the collarbones too. We don't treat anybody without
Yeah,
working on
yeah,
their chest a little
yeah,
bit so that
yeah.
everything can drain upwards, including athletes. And think about how many people that we've treated where they were like about to get some sort of surgery and we worked
Yeah,
on
that's
their
huge.
lymphatics or worked on them in a different way and they didn't need it. Or they did get the surgery and they think it's a fix, and then their same problem comes back
Comes
because
back.
that wasn't
That
the
wasn't the
actual
actual problem.
solution. So that's interesting, but there's some other things that are honestly struggles for all of us, but the collagen, like our collagen isn't as strong anymore. We're getting dirty electricity all the time. It's stealing our minerals. We're getting exposed to glyphosate, which has a
Mhm.
glycine molecule in it. But the glycine molecule has all this other junk attached to it, but our body makes a mistake and sometimes incorporates the chemical glycine molecule that's attached to glyphosate as glycine for our muscles or for our tissue. And people are more prone to tears than ever before
Mhm.
or re-tearing. More than ever, we're seeing like, chronic stealth infections. Maybe it's because we know and because we look for them.
Yeah.
But also, like, that breaks down collagen, so that's something that, needs to be addressed, and, you can help detox glyphosate, you can bind it up, you can replace glycine with TMG if people can handle that methyl donor, you can, take vitamin C, help rebuild the collagen, use red light, all of this kind of stuff, so that's the kind of stuff that we're seeing. You can actually take collagen, but, funnily enough, that's not the best way to recover your tissue, like, using things like silica that bind up aluminum and
Mhm.
other heavy metals. Like we are getting inundated with chemicals. We are getting
Absolutely.
inundated with heavy metals. We like our cells are starving for nutrition. We're stressed. We're not getting outside enough. We're not connected to nature. And that's going to be even more true when you're on someone else's schedule, when you're an athlete traveling around. So things like grounding, things like
You said red light already.
red
EMF, which if you're not
pulsed.
getting outside to ground, that's a
Yeah.
good way to ground inside.
Which is pulsed electromagnetic
Frequency.
frequencies. So, there are like biohacking places in lots of different cities. You can purchase these type of things. Like, we have links for them too, but again, even if you can just get outside in the winter, it's still sunlight. You can just go outside for longer. Touch a tree, before you go on a flight, you ground a bit. When you go to bed at night, you unplug stuff so that you're not getting
Not right next to
electricity,
you.
like, right next to you.
Or, I mean, even from a circadian rhythm perspective, like wearing the blue light or like amber colored glasses as you're getting ready to sleep so that it kind of just helps to wind you down so you're not constantly being triggered by the blue light or screen light that's going to mess up your body's natural rhythm.
Yeah, because our bodies, when light hits our eyes from the sun, first of all, it comes from above. And when in the daylight, it's more blue light, blue spectrum. But in the sun, there's a mix of all of the rays. And then as the sun goes down, you're not supposed to have overhead lights on as well, because the way that the light hits your retina from above. So turn that off. You should have lamps on instead. Your screen gives off tons of blue light at the time that you're supposed to be unwinding, like Leah said, and you're supposed to only have amber light because you're thinking like dusk or when the sun sets. We've been too disconnected from nature and it affects our vagus nerve and our whole system. So those are things that the basics, we get back to the basics first. Drink water, add some minerals to it.
Minerals, electrolyte. A lot of athletes deplete those constantly.
Yeah.
So that's a big one for athletes.
Yeah, and athletes are in a catabolic state a lot. It
Always.
shows up in their blood work. They're going to have higher nitrogen. So, BUN is the marker because they're breaking down their own muscle and tissue, and made of nitrogen. Or your body has to clear it. Your liver has to clear all of the waste from the breakdown, and you're supposed to be able to rest more to recover. And even like, the whole the team mentality, or like especially older school coaches where they're like, you gotta just
Bag skate.
babysit them, and then like they don't care about
No,
your adrenal glands or
no rest.
your recovery.
Mhm.
So, you know, I think that that's a big thing that's overlooked, or some rest days. And I know they're avoided because they think people maybe are going to go partying or something, which honestly, the younger guys,
I
I
think at
feel
this
like
point it's
party less
yeah.
than we ever did. My age, especially, you partied less than I did.
Or even just in general in the summers about like, their training in the summers. Some of the training isn't what
Conducive to what they
what they
actually
actually
need.
need.
Yeah.
Some of the
So,
movements, some of the strength training, some of the
yeah, I mean, when I first started, everyone did back squats. And then I was telling people from, I don't know,
50.
13 when I figured out. And I'm like, back squatting seems like a bad idea. None of these guys can move their shoulders even. And now you're putting them into a back squat and like compressing their spine.
Yeah.
So, I mean, they took that out, but it's still very, could be
Can I say
improved.
something controversial?
Yes. I'm here for that.
Golfing. Golfing.
I know you want to work on your golf game more. We work mainly with NHL players.
Just golfing.
They just,
That all controversy.
yeah, they love it. They want to be better at it than their own sport, but it's a different mechanics. And then
Lot
it
of
creates
injury.
injury. And especially when you like, hire a golf pro and he tries to like change
Change
your
your
mechanics
swing.
even more, like from, yeah, just, I don't know, just realize that's just for fun and focus on your actual sport, maybe. But what are other
I mean, we talked about sleep, which is a
immune
big one.
system,
We
immune
talked about
system, immune
travel,
system?
though, but all these things play into the immune system.
Yeah, but I'm talking about, yeah, like, but we see their actual immune system depleted because
Yeah.
every time you train, your white blood cells exit your blood to help clean up the muscle that's been destroyed. So they're doing their job, but then it makes you at risk for infection.
Mhm.
And you do see even more infection in elite cardiovascular athletes. It's called the J shaped curve. So essentially, when you start doing cardiovascular, it's protective for your respiratory system. But then as you increase past at a certain point, which these players do. Well, soccer does, hockey,
Hockey,
basketball,
even some football positions.
not baseball really though.
Not baseball.
Yeah, I haven't researched that, but I bet they have less respiratory tract infections. But they have more chance of respiratory tract infections. So even like during COVID, they had it multiple times and
Mhm,
they had it
mhm,
first
mhm.
before anyone that I knew had it. So yeah, you can support that in different ways. Like people don't talk about like even nebulizing silver is
Mhm.
something that we love, or taking silver, spraying your throat with propolis,
Propolis,
nose with
nose
propolis,
spray as well, yeah.
the basics. I mean, everyone's like hating on vitamin D, or vitamin D is a hormone, but guys, a lot of people are depleted in
Yeah.
it. A lot of people
Especially
need it based on their genetics. A lot of people aren't going outside at all.
Mhm.
A lot of people's livers are overloaded. And guess what? When you give them vitamin D, it helps. And there's a safe way to do it. You can overdose on vitamin D.
Yeah, you have to be careful.
And we have seen that.
We have
So
seen it, and
we've
it
seen
can
people with gigantic osteophytes
yeah,
because when you take mega doses of vitamin D for too long,
calcifies.
your calcium gets released and then it has to calcify somewhere else so that it doesn't calcify your arteries, and it can create all of these osteophytes or joint deformities. And it's, anyways, so you want to make sure that you need it. Something I think every team should test, which I don't see everybody
Mm-mm.
testing vitamin D. Some do, but that's definitely a huge one. Vitamin A, another one that people don't like. It got a bad name because of like really high dose
Mhm,
Accutane and stuff,
mhm.
but vitamin A gets depleted. Vitamin A is so protective for multiple
So important
infections.
for your immune system.
I mean, we love melatonin, and
I love
melatonin's
it.
getting some hate. We talk about how melatonin's getting
I know,
smear campaign.
but I love it.
It's a smear campaign on something that could save your life. Okay.
Yeah.
So I'm not going to lie. In my fridge, I have 200 milligram melatonin capsules. And if anyone is ever deathly ill, that will be getting shoved in their rectum, because that is a slow release melatonin that can calm a
Life-saving.
cytokine storm and save your life. So why don't we look up that? There was just a study saying, oh, people who took 3 to 4 sprays of melatonin were likely to die of heart failure without any other controls, looking at any other lifestyle. I read it and I was rolling my eyes. And, I don't know why. It's like a different one every time. Fish oil, got like,
Yeah.
and they got me on that one too.
I know, I remember you.
And then I started testing everyone's fish oil or omega balance again, and everyone's super inflamed because, yeah, your body does need more omega 6, but we definitely get way more. I'm not eating any fish. Tried to. There was a worm in it. So that brings us to parasites. So parasites do exist.
Goes to parasite.
Yeah, I'm not kidding. So I
I
got
can't.
fish that's supposed to be like lower content of parasites, because you see those things on salmon,
Oh,
like farm
salmon.
salmon,
I
and like
cannot
how
eat
much.
salmon anymore.
Anyways, this was like a cod, like some expensive, no, halibut. And there was like a little brown speck, and I pulled it and it was a whole large worm, and
It was
like
cooked too, was
the worm was dead and
no, I know,
cooked,
but I'm saying it
but
was cooked.
what we have to remember, and it was frozen first. So the
Yeah.
flash freezing is what protects you from like the eggs and stuff living. But still, like, I
No,
just can't.
that's
And
I would
I was
not.
really trying. I was trying hard to eat fish, but I know pork, when it's not raised right, has a lot of
Parasites.
parasites and like spores that like survive even heating. We're Italian, so there was a lot of pork in our upbringing. But parasites need to be addressed because, again, we get exposed to all the metal.
Parasites are real.
Parasites are real.
Parasites exist. Parasites hijack your body.
Parasites cause, I mean, should we list the symptoms? Like liver flukes can cause liver congestion. I mean,
Pain.
IBS, Crohn's, like
Issues
all
with
have a component of it.
even
Skin
just like
rashes, heart
cholecystitis,
palpitation. Yeah.
gallbladder,
Cholecystitis, which is gallbladder attacks, people might know them as.
any like
Anything.
IBS
Yeah.
issues.
I mean, I suffered immensely with my gastrointestinal tract previously, and maybe as a cause to everything that was able to attack my immune system, because I had parasites for so many years undiagnosed. I mean, I was hospitalized with bleeding bowels, and for sure there were parasites.
Mhm.
And you get sent home and given an antibiotic, and no one gives antiparasitics unless you're going to like Africa.
Yeah,
They give you like an
or
anti-malarial.
Caribbean.
Yeah. And then they like make all of the antiparasitics seem so controversial.
Scary.
Yeah.
I mean,
Meanwhile, if you
there's
look at
so
their
many.
safety profile, they're better than safety profile than Tylenol, better than almost every
But
antibiotic.
even there's so many herbal tinctures and other ways to kill parasites.
Yeah, we're doing the herbal ways, but I'm just saying in general,
It's not scary.
like
It shouldn't be scary.
no, but in general, like they don't really teach MDs in North
No,
America
no,
to
no,
treat
no, no,
them.
no.
One thing that I'll say is toxoplasma, which is
Mhm,
one
mhm.
that creates miscarriages, which you can get from your cats,
And also anxiety and depression.
and bipolar and OCD if it crosses the blood-brain, or depending where it is, it can be excruciating, but it can be pretty stealth too. And so in Mexico, you're not allowed to get IVF unless you
Get
are
tested.
tested and treated if it's there for
Mhm.
toxoplasma. So, yeah, they exist. Babesia, how much do we see that?
Yeah, a lot.
And then that creates symptoms of heart palps, beating heart, anxiety,
An inability to take a full breath.
yeah, air hunger, pain in your liver, spleen can go there,
You said heart.
crazy heart stuff.
But yeah, I mean, even if people didn't necessarily buy into parasites in themselves, buy into it, so many pets have parasites. And
Yeah,
then you have those pets in your home.
I
And
know.
then you let your pets lick you. And then you let your pets sleep in your bed or sit on
Mhm,
the couch.
mhm.
And like they're picking up things all the time.
They get treated better though for parasites than humans do
Yeah.
because they actually believe that they get them. So let's just say you have a dog and it sleeps on your bed and it, goes does its business outside and then
It's a
some
parasite.
remnants get on your thing and then you touch it. Like they're microscopic, you know?
Yeah. It's very easy. It's a lot easier than people think to get parasites.
Yeah. And then even sometimes you can
It's not just frost.
be sick, be sick. Let's say it's like the typical parasite symptoms that people think of because parasites can create any symptom. But let's say it's diarrhea and vomiting and it's acute, but then your body never fully clears it, but no one tests for
Yeah.
it. That causes big problems down the line. So those things are huge. But I mean, okay, let's talk about player, treated him for years,
Mm,
does a parasite cleanse.
mm.
How much better does his body feel?
So much better.
Like on a scale of like 1 to 10. Like,
11.
I know. We had to
Their
spend
tissue.
hours on this one player.
Mhm,
And then he does the parasite cleanse, does a lot of all the gut stuff to fix it as well with us. And then, but that was like over the summer. And then we see him in the winter, or no, we see him in the beginning of the season.
mhm, mhm.
We're like, this feels like a different body. Like
Yeah.
the inflammation is down, and he's got an amazing contract
Mhm.
and he feels better than he did when he was younger. And that's just one story that I can think of now, but it's time and time again. And, some of the players that we worked with are,
I mean, I just feel like anybody who's like you said, you don't have to have, like, overt symptoms to do a parasite cleanse. I think everybody should do one, I don't know, at least once a year. I like doing it twice a year, but even people who have had symptoms, like, I haven't had anyone come back and not say they didn't feel better.
yeah,
Whether they had them or hadn't, or
yeah,
didn't have whether they had symptoms or didn't have symptoms, I have never had somebody come back and say, "I didn't feel any change."
yeah.
Like, most people come back within even, like, a week or 2, some people who have never done a parasite cleanse before are like, "Wow, my bloating's down," or, "I'm not getting cramping every time I eat something," or, "I'm not having to run to the washroom." And those are, like I said, overt symptoms. Other people, it's like, "My brain fog is gone. My mind's more clear. I have more energy. I feel like I can wake as soon as I wake up in the morning, I'm, like, ready to go." I mean,
Less anxiety is a big one.
less
I didn't even
anxiety.
realize how much anxiety I had and all of that.
Yeah,
So that's obviously
I love it.
huge. And I'll tell you something again. The one year I did not do a parasite cleanse
Tell us.
was the year that Lyme took over my body.
Yeah.
And by the way, another smear campaign on binders, my favorite thing in the world. We'll get into
Mhm.
those. Someone was saying, oh, they're riddled with heavy metals. And, it turns out that was completely wrong. And we can do a whole podcast on that. But I stopped taking the binders, and that was the same time that all of this
That
happened
everything
to me.
started.
So I think,
Plus mold, plus EMF, plus
yeah, plus a new mold it's
viruses,
always like
plus,
a perfect
plus,
storm.
plus,
I'm not
plus,
trying to
plus.
say that everyone has to be on
But
binders. I barely take binders. I still take binders, but like, I mean, mostly because I still can't swallow pills, but that's
that's another story. That's a whole other podcast.
I think I told part of the story, but I have to still do the continuation of it.
But honestly, athletes just there's like Dr. Stephanie said, there's a lot going on all the time. They are overworked. They aren't necessarily always sleeping properly. They can't get to sleep. They're constantly traveling. They're constantly on a different time zone. They're constantly like you said, the mental aspect of like, trying to get your next contract or trying to get played or trying to get whatever it is, like, noticed. There's always something. That plus then, just the daily things that everyone's exposed to, like dirty air, dirty water, pesticides in your food. Some of them don't necessarily cook for themselves, and so then they're ordering Uber Eats 3 times a day, and what type of food are you ordering?
Yeah.
It's probably not the best food, and even if it's marketed as better, there's only so much of that you should have before it's gonna also cause problems. There's a lot to it.
Yeah. And honestly, if
Eh,
I were an athlete, let me tell you what I would do. I would have a chef. I would have
yes.
a cleaner using non toxic cleaning stuff. I would have an oxygen bath. I already have that, and I'm not an athlete.
Sauna, red light.
Sauna, red light, PMF is good, but those are my favorite thing. And I mean, I get treatment all the time.
I
That's a
love
no-brainer.
treatment.
Treatment, again, proper treatment. Most people that had the combination of Lyme, parasites, mold, and immune dysfunction that I had, they're bedridden once that turns.
Yeah, yeah, yeah.
And I
That's what
mean,
that doctor said to you. I can't believe you're not. I can't believe you're here right now. I can't
yeah,
believe you're not bedridden.
yeah. So, I got even re-passionate about soft tissue therapy and proper, like always the way we were doing it. And I mean, I was just tired and couldn't do it.
Yeah.
Like I feel like it is an art the way that we do it to like toot our own horns, but like it's pretty good
Yeah.
because I don't know where I'd be if I didn't. So that's my whole point.
Yeah.
If
That's
I
fair.
didn't understand the body like I did. And I'm trying to teach people that are going through it. And it's really hard because it took me being in this field, going through it myself, for me to really wrap my head around it.
Mm-hmm.
And so I get how some things seem completely unrelated, but there's an epidemic going on and it's called, it's mast cell activation or histamine intolerance triggered by
That is huge
all the
right now.
toxicity going on, plus the EMF that was released onto us. That's a direct wave when we're used to scalar energy and we're not taught that what it can do to us and how
Mhm.
it affects our bodies and our physiology, especially if we have in our body colonized mold or parasite
Mm.
or bacteria that are detrimental, pathogenic. And now they get more pathogenic when exposed to these rays and we can't see them. And if we really think about it, we can feel them. But, some people are more affected because they do have heavier metals or different, mold toxins. Because again, I talk about this a lot, but the study on mold where they exposed mold to 5G and it made
Mhm.
600 times more mycotoxins. And that's what makes you sick. People have mold living in their body. Wi-Fi gets to our skin. They said the reason that it's safe for humans is because it can only go a few millimeters deep,
Mhm.
but it reaches what our sweat glands are in our skin. Our sweat glands can communicate with the rest of the body.
And our skin is the largest organ. I think people forget that it's an organ.
The skin's the largest organ too. So yeah, I mean,
It's a network.
everything's connected. Our fascia's there. We know that's intricately connected to every organ. So you're not protected from something just because you don't directly feel it
Mhm.
immediately. It wears down on your system and it's probably ending a bunch of careers that people don't even realize.
Yeah.
Because if they could cleanse their body, because I'm telling you, I'm sitting in a room right now with not great lighting. There's shit plugged in all around me. And would I have been able to sit
No.
here a few years ago?
No.
No, I would have been jumping into my skin. I would
Yeah.
have felt like I couldn't breathe. My heart would be pounding,
Mhm.
but I detoxed out my body with a lot of hard work, a lot of manual treatment
Mm.
we're trying to teach you about in our lymph course, our deep lymph and fascia course, because we're talking about the deeper lymph and we're teasing fascia and we're trying to really get you guys to understand why.
Can I say something?
Would love that.
Can we talk about mast cell activation? Because I feel like we didn't say enough things about it. Like what does it actually mean?
Oh yeah.
What's happening to people?
Yeah.
Because this is huge. I feel like so many people are having these weird symptoms where they might feel like very anxious, or they're getting like super bloated, or they're feeling like, I mean, some of these symptoms overlap with other things too, right?
Yeah.
But um they're having like the chest congestion or the heart symptoms, or
Hmm.
bowel issues and
Rashing out.
rashes.
Hmm.
And they're like, why is this all turning on now? Or why is this all
Yeah.
happening? I
And then
was
it's
fine a month
never,
ago or last
yeah.
year, or
And it's never tied all together to the systems. And like, okay, so mast cell activation, I don't think can exist without what we were talking about,
yeah.
having
Yeah.
multiple of either a heavy metal combined with either Lyme or mold or
Yes.
like long COVID viral load in your body or EBV. So I think those are just toxins. So your toxin load is high. And then there's a priming event. So even the priming event can be like a severe trauma where like, your cortisol goes through the roof, or it
Or
could,
a reno on your house.
or a reno on your house,
Or
or
just like a
A night
stressful
of
situation.
partying.
Yeah, I was gonna say like
Yeah.
you're a student and you have 14 exams to study for and you're staying up all night studying or you're partying
Yeah.
or you have a really important game
Yeah, and so
or
the
you're
body gets overwhelmed, and your mast cells are part of your immune system. And one of the main things they release is histamine, but there's also tons of different cytokines and inflammatory markers, and they all play a role. But then when your body starts overreacting and your mast cells start dumping all of those inflammatory markers,
Mhm,
the histamine,
mhm.
your body can't keep up with that much waste and damage because even when it has to kill a bug, there's some damage that's created. But then when there's so much release, then your own cells can start to be damaged because there's an overreaction and it can turn on autoimmunity. So mast cell activation, you can feel fine and then you smell like a strong smell, like a chemical smell or even
Mhm.
a perfume, which are full of chemicals. And, your heart starts racing.
Or a car freshener.
Car fresheners, I threw so many car fresheners out of cars, either rented
Ubers.
or Ubers.
Car air fresheners.
Yeah, so then all of a sudden, your nervous system's hijacked. Your
Mhm.
autonomic nervous system is now going
Not
crazy.
regulated.
You're just in your sympathetics. And I mean, you just want to jump out of your skin, impending doom, all of that. And then the other symptoms can be differing depending on what type of
What
bug it
you're
is,
already dealing with.
what part of your body's already like the weaker link, like
Mhm.
genetically, or somewhere you've
Yep.
been injured in the past, or like where you've had a rash in the past. Like, so the liver there's usually some sort of detox capacity that's lower. So, I mean, once it turns on, I mean, this is no joke. And it takes a lot of diligence to bring yourself out of this. The younger you are, more resilience usually. But, people that where they're not taught it's that, where their mast cells aren't calmed down, where they're
Mhm.
not, binders were a huge thing because there's binders that they bind up histamine and biological waste, right? So your own biological waste from the mast cells. Like people, again, some influencers are like smearing binders.
Mhm.
Like, no, that's not the only treatment you use, but have you actually been through this? Because I don't know I can't get people through these things without cycling through different binders.
Mhm.
And binders are like literally sponges for the toxins that we talked about, even our own toxins. So our own body, when our cells break down, it has to be cleaned up. That's biological waste of our own biology. But then there's the bugs, which
Release
poop.
their own toxins.
Yeah, which are doing their own bodily processes inside of you. And
And
then
then the
they're
mold toxins, and then the environmental toxins, and then
heavy metals.
the pesticides.
And then your mitochondria go into this cell danger response and you're not clearing anything out. And you're just stuck in this feeling shitty every single day. Your eyes are puffy, your lymph isn't draining
You have
because
rashes.
you have rashes. Saying that our friend said,
Mhm.
Sinclair, was the solution to pollution is dilution.
And you love that
I
now.
love that because it's just like your body makes a whole ton of lymph, which is part of our body's sewage system,
Mm.
and to dilute the severe amount of waste from if it's mast cells, a lime, blah, blah, whatever. I mean, you have to figure out what your trigger is, though, and you have to find out what your pathogens and your toxins are to get them out. But that's mast cell in a,
Nutshell?
but I
A
don't,
lot of people are suffering from it, though.
I think, I mean, a lot of people are calling it long COVID, but I mean, COVID is just the spike
The
protein's very
trigger.
inflammatory, and that's the
Yeah.
trigger. And honestly, you don't even have to have had a overt infection. You
Mhm.
just had to have an exposure for it to be showing up like that. I feel like I touched a bit about this on the last podcast because I actually used an example of the house toxins
Okay.
was a trigger, the priming event. When you do a renovation with a lot of chemicals, like, and you already are prone to this, like some
Mhm.
people can breathe and that
No
nothing
problem.
happens. I wish I was one of those people.
But honestly, I'm even like, I mean, not triggered to this extent, but I'm even triggered when I like walk by someone and I just smell Tide.
Yeah, I know.
Like I
Yeah.
can't handle that. And that's just like, I don't even know how someone's wearing the clothes that smell like Tide. I can't even be next to them. Or I'm treating someone. How many times you're treating someone and then your fingers and
Yeah.
your body starts to feel like
Like my chest
staticky
tightens
and
up.
like
So,
anxious because there's that
so
chemical.
that brings up a good point. Can I tell you something?
Yeah.
What I think is one of my triggers? Fake fur. I feel like this is getting in my mouth and then I'm feeling funny. Use it like this.
The
My mouth is buzzing.
other day she made me throw my shirt out.
Yes. Can we talk about
Clothing.
high quality
Clothing,
clothing, or what material you place onto your body.
linen,
Yeah.
organic cotton.
Yes.
We're not perfect. I'm not perfect, so I don't always wear those things, but it definitely makes a difference
I'm
if you do
slowly
wear them. Trying to convert.
I'm slowly phasing them out, not slowly, like, actually quickly now, but I mean, those, like, anything staticky on my
Yeah.
I wanna literally lose my mind, but
Actually, the other day, I didn't mean this. The other day I was wearing a different sweater,
Mhm.
and I had to take that sweater off because I was so static wearing it, and I was like, "I have to throw this out now."
Yeah, it's
And
terrible.
you're right, like, maybe those things well, maybe I wasn't aware of them, but, like, those things, like, when I wasn't feeling as well, were making it way worse.
Yeah, because you were feeling anxious when you were, like, sitting or
Sitting, driving, yeah,
driving was a huge one, though. Remember even when I was driving beside you when I was really bad and I'm like, "It's
yeah,
happening,"
yeah,
like, it
yeah,
would
yeah.
just, like, come over me because we can't drain when we're crunched down, and
Driving
I don't know,
is
there's something about the
so
car there's something about the concavity of
of
the glass,
yeah,
I mean,
the
moving,
seats.
it's terrible. But
Even, like, theaters, movie
knock off.
theaters, just, like, any sort of theater where you're having to sit in a seat that's kind of, like, reclined back a little bit, compressing all
Or
your
like that.
organs, yeah,
No, I
can't
need
do
it
it.
reclined, but when it's like
No, like,
yeah, you're more like scrunched.
you're more in, like, a V position.
Those aren't good. That's not great. But movement, yoga, Pilates, because even we work with athletes and they're not stretching they only stretch for
Yeah,
their game, but
yeah,
not for
yeah.
like flow of lymph. So those type of things can be really, really helpful. But clothing is another one that you can slowly switch to those higher quality clothing, even if it's not organic cotton, even if it's 100% cotton, it's less
Yeah,
conductive.
it's better.
Yeah. And
What's the thing about linen, though, that it's bad to
wear with cotton or something.
yeah,
Yeah, I don't know, I never looked into that if it's
remember
true,
it
but
was,
they
like,
said it
the
was, like,
frequency
the
of it.
frequencies don't go well together, but I mean, I don't know. I've worn them together, and I'm very sensitive, and I didn't feel
Mhm,
anything, but
mhm,
I really do need to look into it more
mhm.
because yeah, but
Even sorry, I was just thinking about what you put on your body, and then I was thinking in relation to athletes, because especially with the guys we work with, there's a lot of equipment, and then so many times equipment can get moldy, or sometimes things that the the detergents that the equipment's washed with isn't always the best, and then that combination can cause like rashing
yeah, like,
or
really bad
reactions
reaction.
for them as well, because either it's moldy or it's toxic detergent.
Yeah,
So it's something else I just thought of
yeah,
to add
and
to
we try and another thing, which I think I don't talk about enough, we've talked about it before, but HOCl instead of, like, washing your hands with, like, triclosan soaps that, like, wash off all of your good bugs that you have, like, on your hands and stuff, like, HOCl, Briotech is the one that we use, but there's other HOCLs, and it's just, like, water, vinegar, electric current, and it's what our cells make to kill bacteria, parasites,
mhm.
and you can use that instead of alcohol because alcohol kills the good stuff too. Use it instead of, like, sudsing up your hands with, like, the toxic soaps or clean soap at home, like body products, obviously, full of parabens and endocrine
Mm.
disruptors. Most people are getting into the know about those things, but I think sometimes we overestimate.
Assume
Yeah,
that
or
people
just
know
assume
more.
that people know more. So when you're slathering something on your largest organ, which Leah pointed out,
Sorry. You keep going. No, remind me about detergent after.
okay. You're slathering it on your whole skin, like your body cream better be clean. Like, I
Yeah,
mean, like
your
you're
body
literally
soaps, your
absorb
body
it
creams.
into you absorb it into your bloodstream, straight into your arterioles, into your bloodstream. Like someone like needs to know that what you put on your body goes into your bloodstream. So I use Body Deli. I think
Yeah, I
you
do
do as
too.
well.
Yeah, I do.
And then, I mean, we use other stuff sometimes too, but just like there's so many clean products now. So just look for things that are paraben free and phthalate free and sulfite free.
Yes.
I don't know if that's a S and OS
AOS.
or like in clothes and stuff too.
All I was gonna say was sometimes even when you think things are like natural and non-toxic because they're marketed that way, they're just
Hmm.
greenwash products.
Yeah.
So we've had a time where we bought a detergent
Oh my God. We washed all our clothes with it. We had to go to a different city for like a conference or something, and all our clothes
smell.
reeked. I couldn't even
They
put
were
them on.
so toxic.
I couldn't even put them on, and, like, I would love to
Or sleep in
desensitize
the like
I'd love to desensitize myself to that though, and, like, I did use low dose immunotherapy to help desensitize myself to a lot of things, but I need to go stronger so I can do that to the fragrances. Cause
I've never been able to handle that.
but I think I did. I
I
must
think
have
you
at some
must
point.
have, yeah.
Like, we used to use whatever.
Yeah.
I
Yeah,
mean,
that's true, but I think things got worse too.
yeah, that's
Like,
true.
Tide got worse, like,
Yeah,
and
like, if
the
you look at
liquid Tide and the pod Tides
yeah,
are I think are even worse than the powdered Tide.
I think so too.
I think the
Those are
powdered Tide is
terrible.
not as bad,
Yeah.
like, smell-wise.
Something else we're seeing a lot more of, and I think this happens with the mast cell toxicity, is that like acidosis, metabolic acidosis, because when we're looking at people's blood, they just look acidic and
So acidic.
yeah, and that makes you want to jump out of your skin too. And I don't know, is that from the mast cells or is that something separate? It's really hard to decipher. It's nice to see though the cardiac events are lessened in athletes because 2021, 2022 were an all-time high, and if you know why, you know why. High calcium, we've been seeing a lot, and
Still.
honestly, still seeing it, and I think really that's an EMF thing, and I think honestly that's partially for the MCAS or the mast cell activation.
Yeah.
Because, like,
100%, I agree.
never saw that before, and I mean, I looked back, was I just not
I know,
zoning
because
in?
it's not
And
something
then
that
I
you
was, like,
realize.
looking at old blood work from people that have
It's
high
not the
calcium
same.
now, and it's not the same. So, and then I just had someone where their mast cell activation turned on, and they had just had blood work a few weeks before their prime event, and it
Mm,
was completely normal. And then their
interesting.
cholesterol
Yeah, yeah.
spiked and their calcium's way higher and their albumin's way higher binding up to the calcium. So it's very interesting to see when that happens, when you see, just happen to have like fresh blood work and then someone has an event and then it's like you
Mhm.
see the changes happen. So yeah, I'm trying to think other common things that we're missing with not just athletes, but in general that we talk about all the time.
I mean, I feel like, well, we kind of already said this, but, like, so many people are getting stuck in their abdomens.
Yeah.
Like,
People's organs are stuck together.
yeah, everything is, like, fascia's stuck, organs feel stuck, abdomens feel tight, like,
They're not moving
yeah,
like they're not like people are having pain in their abdomen and
and
abdominal.
tenderness.
Yeah. Yeah. I mean,
So much
that's been
tenderness.
a huge last symptom for
I
me
feel
to
like I
get rid of.
treat so many people's abdomens, and, I mean, maybe it's also because 'cause we're more aware of it now, but way more than before.
Yeah. I mean, I think we were just
And it's not that we weren't touching them before, like, to work on psoas and hip
no, yeah.
flexors and
No, all the way up
rectus
to the
abdominis,
rectus
always, like, working on those things, but it just feels like they're so
more
much
stuck.
worse.
Yeah. But I think there's so much more inflammation.
And 80% of lymph is made from the intestines and liver.
Yeah.
So,
So
it's trying to
clean up and
clean
if
things.
things get stuck, make too much pressure. Yeah. I've never had this much pain in my gut and I've had tons of gut symptoms.
Mhm. Yeah,
Never
especially
got
for you.
this stuck
Yeah,
before.
yeah.
Yeah. Yeah, so if you have these type of symptoms, like some of the things that we talked about you can do, but we didn't talk about food, but again, eating clean, the dirty dozen
Eat the clean 15.
for vegetables.
I mean, it's the problem is it's just really hard for people
I
when
know
it comes to food now, like, that that
some people can barely eat anything.
no, I know. But even I was gonna say that,
Fake meat,
the fake meat,
it's disgusting.
the cloned meat or something?
Like, I mean, clone something
What?
else.
And they're not gonna tell you which one it is?
I know.
Like, what can you buy at the grocery store?
You got to get to know a
Between
farmer
yeah, between, like, cloned meat and then GMO crops,
and then being sprayed with God knows what
that
chemicals. I mean,
it
it's
just
just
seems like it's really hard.
it is hard. And your system's gonna get overloaded at some point, or someone you know is, and you're gonna be like, "What was that podcast I listened to where those crazy ladies were talking about? I don't know, chemtrails, 5G." Yeah, we find a lot of people's nitric oxides. Okay, let's talk about why is everybody a mouth breather now?
Yes.
What's happening to our nervous system that no one can
Yes.
close their damn mouth and everyone needs a
Yeah.
freaking CPAP, including the athlete?
Yes. Yep.
I
Well, I
don't
mean,
know.
I just saw
Makes sense. Suspicious.
a doctor the other day that said he's noticed, he's a dentist since COVID with all the mask wearing,
Mm,
so many people
okay.
became mouth breathers in his
As
practice.
someone who never wore a mask
Yeah.
proudly, my tongue got weak and I wasn't wearing a
Yeah, so
mask.
maybe there was more to it.
So, I
But that's
I
what he was saying to me about
like, why am I all of a sudden so aware of where my tongue, like,
Mhm,
and
mhm.
then I actually got my tongue tie cut Leah's strengthening her tongue, like with myofunctional
Myofunctional.
therapy, and I had to do that pre and post as well. But tongue posture is really
Yeah.
important, and it's important for athletes, and it's important for them to breathe properly at night to keep proper oxygenation of tissue and not get acidic because your breathing is huge. So yeah, but I mean, I would love to do a poll and see who's never had a heart palpitation before 2020. Don't think
That's a
I
good
ever
poll.
had. I think I could count on a hand how many times I'd felt a heart palpitation. And I was like, what was that? And
Yeah.
then never felt one again
Yeah.
for years. And like never had any cardiovascular symptoms whatsoever. So I don't know. Felt very frustrating. I think we have some of the answers. We might be missing some of the things, but yeah. Oh, sinuses. That's a huge one.
Oh, yeah.
Because we breathe in the molds and all of that. We start mold stronger. The mycotoxins weaken your, lining of your mucosa in your nose. It can colonize in your gut and your lungs, like actually live. Like there's one thing to breathe in the spores, which are the mycotoxins, or the actual bug lives inside of you. So, when they actually colonize and live there, then they're making the mycotoxins inside of you.
Mhm.
But they can weaken everything. They help other bugs create biofilms with them, so they're hard to eradicate. So there's a lot of chronic sinus infections that are part of our athlete population, but so
Also,
our regular
they're
population.
usually around, like, once again,
Mold.
mold. They're moldy equipment,
Mold in
rinks,
hotels is
and
huge. Rinks, which is the only athlete. This is it hockey that we're talking about.
hockey rings. But hotels, traveling, yeah, it's huge.
Yeah. So some answers. We talked about binders, for the mast cell activation, there's like histamine.
Histamine, digest.
There's things that break down your histamine. That's the enzyme, the DAO enzyme that is called histamine digest. There's mast cell stabilizers that are natural, like quercetin, rutin, luteolin. There's more than that, but vitamin C. There's a bunch of histamine stabilizers, and there's histamine binders.
Tox prevent.
So that's a clay-based one. There's also biotoxin binder, binds up histamine. So do most humic and fulvics. Charcoal binds like everything, but it's only in the gut. So if you have lots of histamine in the
Mhm,
gut, it
mhm.
can be helpful. And then, finding someone who can help you look at your toxic load, which can be as simple as a urine test, which we actually have coming out just where people can just do their toxin test
Mhm.
and do like one meeting with us just to see out of, curiosity, even if you aren't sick. The best medicine is prevention. I was doing my best to prevent, and then I took a year off my prevention and it didn't work out well,
I
but
think
I
it was
have
just you were still doing stuff. I think
it was just a stressful time.
yeah.
It's always like a perfect storm, and I don't know, maybe it was meant to happen so that I could share my story,
Mhm.
which I'm doing a lot. You can support your liver. You can support your liver with foods that are um bitter, things like
Lemon juice.
dandelion, lemon, ginger, different fibers that help support your gut microbiome. They help to support your liver, different types of mushrooms that have high in beta glucans that can lower like toxic estrogen and different toxins that help you. There's always antioxidants, which you can get from, different colors of fruits and vegetables,
Mhm.
or you can take supplements that are antioxidants and you can cycle through them. You could do a parasite cleanse once a year, making sure you're doing binders and supporting those
Your liver as
organs.
well.
Yeah. People put a lot of hate on parasite cleanses, like your body cleanses itself. Like, okay, sure. Can it do everything that's coming at it now? Has technology gone way faster than our DNA changes? Have
Yeah.
they added so many more novel chemicals to a list, not even to mention novel viruses? I mean, it's a lot for our body to contend with. And I'll tell you that there comes a point where you need intervention and you're better off with prevention because I'll tell you, it's no fun. It's no fun. But
We already said electrolytes. We said minerals. Lots of people are depleted in their
depleted minerals.
minerals.
Everyone only takes magnesium, but I mean, there's more than that we're depleted in. And every mineral can help push out a heavy metal, and every heavy metal can take the space of one of your minerals. But if you make sure you have enough minerals, your body will kick out the heavy metals. So
Mhm.
that's something to keep on top of. Clean water. Don't be drinking that tap water. That's a simple thing.
Hate.
Once you start drinking water that's filtered and clean, and then you take a sip of tap water that hasn't been filtered at the source, you'll know what we're talking about.
Sorry, I just have to mention silver.
Yeah, silver is magic. Silver,
We love silver.
I love metals. And let me tell you, not heavy
Not heavy
metals.
metal.
These are called noble metals. You might recognize them. Silver, gold, platinum. Yeah, those have been
So
Another
helpful.
smear campaign, life-changing.
Mhm,
Another reason that I'm not bedridden.
mhm.
Silver,
Micro
antimicrobial, it cools your insides, so there different times you want that, but, when you have a lot of heat from inflammation,
Mhm,
it kills microbes without killing your good microbes.
mhm,
It doesn't stay in your body. 99% of it is left out. Zero point 0.1 sometimes stays in, and
mhm.
it's non-toxic, especially when it's made properly, and structured
Right.
silver is more protective than just plain colloidal, and you can use it for longer. We've stopped bleeds in people's bowels.
Mm.
I healed severe esophageal burn and gastritis caused most likely by Campylobacter. I mean,
Even,
it's
like,
helped
topically
people topically,
with wounds.
wounds, blemishes, like I was breaking out a ton. Silver gel. We love silver gel. We love castor oil. We love red light. Gold. I mentioned gold. I'm doing some oral gold, but gold is protective. It's most potent antioxidant. It's more potent of an antioxidant than hydrogen ions, which I also inhale hydrogen
Hydrogen.
ions. And you can drink hydrogen and you can use the little tabs that help your hydrogen, and we all need the antioxidants, and that's going to help with all the mast cell stuff and all of that as well. But I had an IV of gold, which if you listen to this podcast you've heard, but it was the biggest game changer for stabilizing my health. As in, I was doing pretty well, but then I crashed like 3 out of 7 days a week,
Mhm,
and it stabilized that. And I really do feel with one more that I could be better than I was before. Like not just 100%, but
mhm,
like
mhm.
above that. So it's not widely available because it's something that got deemed as dangerous, but I don't think it ever was dangerous. I think like everything else, it was a smear campaign when, there was something else that they wanted to sell. Like really and truly, if you make colloidal gold, it can be very cheap, and silver is very cheap. And you can't really regulate it because people could get the
Mhm,
electrolysis machine and make it so easy. So, colloidal gold, again, is a potent antioxidant, but it's also biophotonic. So, because we're light beings, it brings back our light energy, and it makes us literally start to radiate better frequencies. And I felt that. And it's just, I can't say enough about it. I've been reading more and more about it. But that, and then I have read less about the platinum, but there are people using platinum. I had platinum in the IV that I did. Chromium, also protective. Like all of these mineral metal things that we don't understand well can be game changers and should be in the back of your mind if you're going through anything and you're not getting better. I think of other things, but I think that was a lot.
Mitochondrial support.
Mitochondrial support. Yeah, I mean,
NMN.
mitochondria.
None.
Yeah, NMN is a precursor for NAD, but that feeds straight into your mitochondrial cycle so that you can make energy, what's called the Krebs cycle, as opposed to glycolysis, which makes only 2
2.
ATP as opposed to 20 something. So obviously you want to go down that pathway. You also need oxygen present though. Some people that herks from NAD is because they honestly are too depleted. So then there's other things that you can do, like,
Mitochondrial energy.
yeah, mitochondrial energy
There's
has
the
all of
same
the different
complex.
things that play into your mitochondria, but urolithin A,
Oh, yeah.
potent antioxidant for your mitochondria. Yeah, we've been trying to support people's mitochondria again before it was like a very popular thing to do. Oh, but
Mhm,
then there's also, yeah, PQQ, coenzyme
mhm.
Q10. Those CoQ10 is in the mito energy we were talking about. But yeah, a lot of antioxidants that support, yeah, our mitochondria are just getting the shit kicked out of them, for lack of better words. And then there's beautiful herbals and stuff that there's that, you can kill things and they're antioxidants. Japanese knotweed can get rid of like a lot of the spike protein, but also support um antioxidant. It can lower Lyme, all of that. It's known as resveratrol as well. Didn't do that, but okay. But I think we covered a lot. This might have been a long one. I hope you guys enjoyed this. Any final words, Dr. Leah?
Well, I mean, I think all these topics are relevant not just for athletes, but for everyone. And at the end of the day, I think that it is harder to live and do things right in today's world because
Mm.
we are constantly being thrown different things and having to try to adapt. But I think that there is hope and people can get better and people can still live their best lives. It just, you have to want to. It's not as simple as it was before where that was just the option.
Yeah.
You have to choose that option. And I think also this idea that you know, you're going to age and you're probably going to get a disease and you're probably going to end up on, 20 medications. And that's doesn't have to be your option. And I had someone say that to me the other day who works in a hospital and is doing some further education. And they pretty much just said, like, oh, it's really sad because I just realized everyone's just going to get diseases and be on meds and die. And I was like, okay, well, everyone is going to die, but you
Yeah.
can choose whether or not you want what type of life you want to live. And that's always an option to
Mhm.
choose that other route.
I
Not
would
have
say
to.
some people need to work harder.
Yeah, absolutely.
Yeah.
It's not it is like, and it's harder to make that choice when you're being thrown way more than someone else. But
Mhm.
it all starts from like
No,
making the
I
choice,
totally
right?
agree to you about the choice, and I'm
Yeah.
just saying some people can treat their body like an amusement park and seem just
Yeah, and who
fine.
knows what will happen down the road, right?
No,
So
I know. That's true, but
that was just something that stuck with me because I was like, "Wait, no, that's not
I had an
that's sad that that's what you think."
I had an
Not you.
oncological yeah, I know. I had an oncological surgeon say the same thing to me because he was, like, chronically in pain, but every time I saw him, he's just drinking, and
Yeah.
he was like, and I was like, "Well, why don't you do this and lose some weight and work out?" And he's like, "'Cause we're all just gonna get cancer and die anyway."
No. So
No, but that's just what he worked with every day.
I know, I think yeah, obviously, it's partially what you're
I
exposed
choose
to.
to see that people can heal and
Yeah.
become whole again and learn from what they've gone
That's
through.
because that's what you did.
That has to be the answer. Just kidding. But yeah, if you're suffering and you're hearing this, then I hope we gave you some ideas. And if you ever want to reach out, then
There's a
we can
lot.
help
There's
you.
so much that you can talk about, but this is just
Yeah. And
the surface, so
check out our deep lymph and fascia clearing course once it comes out soon. We put a lot of work into it, but when you're putting a lot of work in, it takes a while.
takes
And
a
when
long
you're
time.
still working with other people and, mastering the information. But yeah, we're excited to get that out to you. And then we hope you enjoyed this podcast.
Thank you. Thanks for having me, Dr.
Thanks
Stephanie.
for being here. You'll be back soon.